Okay, take two of this. I recorded it and then realized that I had used the wrong camera. Anyway, I hope that all of you are doing well this morning. Hopefully everyone can see okay. Yes, I'm sitting on an unmade bed because I've been resting in it. So, first of all, I want to thank everybody who was sending thoughts and prayers yesterday. They were definitely appreciated and definitely felt by everyone there. As you can see, I'm going to try to pan the camera over. As you can see, I have a big cup over my right ear with a bandage underneath it. And you can see there's a strap that goes all around my head for the cup. I can apparently take it off this afternoon, which I'm very excited about because it's very restrictive. As a side sleeper, it only allows me to sleep on one side, which is the side that isn't on it. If I roll over onto it, it hurts. And no, I have not tried doing that, but I know for a fact that it would, because it would push down. So I just thought I would give a brief account of what all happened yesterday, for those that might be wondering. For those of you new subscribers that don't know, I had a cochlear implant put in yesterday. I had the internal piece of a cochlear implant put in my right ear. So yesterday morning, we got up literally before dawn. They wanted us at the hospital by 6. The start time was originally supposed to be 7:30. The time we were supposed to be there with a 9:30 start time, but I think something happened, and so I was able to get slotted in earlier, which turned out to have a lot of advantages. So we get there, and after doing all the paperwork and stuff like that, we go up to the surgery area, the pre-op area, and had to change into a gown, which the last time I had been in a hospital, I was 14, having an eye surgery, and I do not remember having to change into a gown. I'm not saying I didn't do it. I just don't remember changing into a gown. And so I did that, and they made me wipe my body down with sanitizing wipes. And then the nurses came in, and I have to say that the nursing staff at U of L Jewish Hospital was absolutely phenomenal. They were very kind. They were really friendly, and that meant a lot. I was allowed to wear my right hearing aid for most of the pre-op time. Honestly, I think the most emotional part, there were emotions running very high yesterday, at least on my end, knowing what was coming. And I do have to say that a tip for anybody that may not be a fan of needles: ask for lidocaine to be given to you before you get an IV. You will not feel a thing. They'll give you a lidocaine injection. It's like getting a flu shot or something. It's a tiny little prick, and then after that, you don't feel anything. I didn't even know that the big IV needle had gone in until she told me, because of the lidocaine agent. And it was really, I'm like, wow, you're good. I didn't even feel that. She said, no, you felt the lidocaine injection. And it was fast acting pretty much, because when I got the IV, I didn't feel anything. The only thing that I was not given, and I realize why now, I had asked for midazolam to be injected into the IV, which is an anti-anxiety medication. But I think it was because I was going to be going to the operating room soon, so they didn't give me any because my wait time was short. I think if there had been a significant delay, they might have given me some, but I don't know. So the surgeon came by, the anesthesiologist came by, and I have to say the surgeon was hilarious. I had met him back in May and to consult with him, and he's a really funny guy. Likes to joke around. Even while they were prepping me and he was making a mark where the implant was going to go, I knew I could tease him, and so I said, "You didn't write that on me, did you?" And he said he put an X in his initials, and I'm like, you didn't make that permanent, did you? He's like, "Oh no, it'll wash off before I even start the surgery. But I am a tattoo artist on the side," which he isn't. But we were cracking up, and like earlier in the year, I had teased him when he was checking my pulse at his clinic, and it was, we had been joking around, so then they hooked me up to the monitors to check vital signs and stuff like that. Had a blood pressure cuff on the leg, which was I remember getting blood pressure cuffs on my legs when I was a baby, but so this has been the first time in a long time. And they also gave me some compression hose for my feet, which that felt weird, but it was okay. It was not painful at all. And I was actually laying on a pretty nice gurney. It could be raised and lowered and tilted and stuff like that. They initially started me in almost a sitting position, even when I was laying down. And then when they were done with everything, they said, "Would you like to lie down?" And I said, "Yes. Can you please lay me flat?" And they laid me flat, which was really nice. It was a bit cold up in the pre-op area, so I had two warm blankets, and so that felt really nice. And then I gave my mother my right hearing aid. And then the waiting game began, just waiting there, being hooked up to vital signs, checking. They'd come by and check on me sometimes, or laying there waiting for a while. And then the operating room team came along, and they said, it's time to go. And the operating room was just down the hall. I would have to say that was the hardest part, was when they came. Because I knew then there was no turning back. And I will admit it, I was coming very close to crying at that point as they were wheeling me down the hall, because I knew what was going to happen. And I remember doing, saying an Our Father, a Hail Mary, and a Glory Be. And also quoting the prayer from Servant of God Delindo's Surrender Novena. But it was rough, because that was when I knew that it was time. And they put me into the operating room, and there was a thrill ride involved. This is Blind Coaster Fanatics channel. There was a bit of a thrill ride involved, and that was the transfer between the bed and the operating table. It felt like a launched roller coaster, a launched spinning roller coaster on my back, complete with a turn. It was quite fun. They strapped me, they put me in this like board type thing, and they put me on this board type thing and just shot me across like really fast. And and they're like, yeah, did you have fun with that? And, I'm like, yes, I did. I actually enjoyed that. I had a lot of fun. So, the last time I had anesthesia, I was 14, and I was a pediatric patient. And I was told in pre-op that things would be different now because I'm an adult. I'd get it would be a deeper sleep and a heavier dosage and whatever. And when I was 14, I don't even remember being transferred to the operating table when I was 14. I don't even remember that. And when I was 14, they gave me anesthesia through inhalation. And they put a mask over my face and had me breathe in the agents. Well, this time they used the IV that I already had on to do it. And I had been watching Max Feinstein's videos on YouTube. He's an anesthesiologist in New York City. It wasn't because I was anxious. It was because I'm fascinated by how this stuff works. And so, they allowed me to keep my left hearing aid on literally until I was on the operating table so that they could communicate with me. And, I was being operated on by an ENT surgeon who was familiar with hearing aids, and so he knew how to take it out and put it back in without damaging it, whatever. And so he said, you can keep it on you until the operation starts. And so I was happy about that. So I got to hear what the anesthesiologist was telling me. So they get me on the operating table and hook me up to monitors again, and blood pressure cuff and all that. And I had expected to be given midazolam in the OR since they didn't give it to me in pre-op, but they did not do that I could tell. So I get hooked up, and they're putting the stickers on me for the monitors, and on the chest, and I think there may have been one on the forehead. Can't remember. It was, and then he put an oxygen mask over my face and said, I'm just giving you some oxygen to breathe. Nothing more. So I'm breathing in the oxygen. Not sure what was happening next because I assumed they were doing final checks. And the surgeon was behind me. He had lowered my head down so that my body was higher. And they had put a pillow under my legs. And I asked him, I said, why did you put my head down? And he says, oh, you just made my job a whole lot easier, and whatever. Again, his humor. And, excuse me. So I had the oxygen mask on. And the last thing I remember hearing was something along the lines of, you're going to sleep. You may feel and taste, you may taste something weird. That's normal. And then it was like I was in a high-speed elevator going down underground somewhere. I was completely knocked out. The last time that I had a surgery, I was not aware of what was going on around me, but I was aware of time passing. And I was aware that, I knew I was lying down. I knew I was, I wasn't feeling or hearing anything, but I knew I was laying down, and I knew I was asleep. But this time, it came on so fast, and it literally felt like I was in a descending, or on a drop tower ride, like Drop Tower at Kings Island or Fear Fall at Kentucky Kingdom. It felt like a very fast descent, and then it was like I was turned off, as it were. It was like I was shut down. And so, I mean, obviously I have no memories of what happened. After, the last thing I heard was, you may feel a weird sensation and taste something weird. That's normal. And then just, I was gone. And the next thing I knew, I had asked them to wake me up for the roll between the operating table and the gurney, because I wanted to experience that again, but they didn't do it, you know. And I realized that, you know, they were, I thought it was fun, but it was more serious, you know, and whatever. But anyway, so the next thing I know, I feel myself kind of rising, like, it was like coming back, like being on a drop tower going towards the top. And I became gradually aware. And my left hearing aid was in, so I could hear. And the nurses that had helped me in pre-op were there. And I was in the recovery room. And and I had monitors. They had moved a blood pressure monitor to my arm because I was no longer on the operating table. They moved it to my right arm. And I could hear monitors and whatever, and I could hear other patients around me. And what I really felt at that point was pain. I was a headache. And it was pretty bad at first. I would say on a scale of 1 to 10, it was, I would say maybe about a 7 or 8. They gave me some injections into the IV to help bring it down, which helped a lot. It got to about a 5. And then they absolutely made my afternoon by saying, well, we have something to eat. Do you want crackers or Jell-O? And I love Jell-O, so I'm like, I'll take as much Jell-O as you can give me. And they said, well, we have quite a bit here. And I think I may have gone through about 6 or 7 cups, maybe a little less. I don't know how exactly many cups they gave me, but they gave me a lot of Jell-O. And they were kind of monitoring me for a little bit, and we were talking, and it turned out that a 2 to 4 hour procedure only took about an hour and a half, and there were no complications at all. According to what my surgeon told my parents, this was one of the easiest implantations he had ever done, because he was able to see everything, and he was able to see where everything went. And I have had no side effects. I've had no vertigo. I've had no weird taste sensations or anything like that when I taste things. And I think there's only one explanation for that, and that is, I think God was guiding his hands, and I think that God was hearing the prayers of everybody that was praying for us. And that was definitely very much appreciated. It meant a lot. And we all definitely felt them. So they did give me a Norco pill at one point to bring the pain down further in between Jell-O bites. And that brought it down even more. I took a Norco earlier. The pain is slowly receding. It still hurts. If I open my mouth too wide to eat something, it hurts a little bit. But as far as he was able to preserve some hearing in my right ear, I hear bass. I hear some bass frequencies. And it wasn't as bad as I thought I was going to probably go completely deaf, and I had been told I was probably going to go completely deaf, but I can hear some bass in my right ear when I do certain things and stuff like that. I can hear some, if I hear something low-pitched, very low-pitched, I'm aware of it. And so it wasn't like I was on a different planet. I'm honestly kind of relieved, though, that most of that hearing is gone, because that my right ear had been, the hearing in my right ear had been declining rapidly for a while now. And so honestly, for me, it was a bit of a relief, as weird as that sounds, to finally, you know, what would have eventually happened anyway. And I'm not sad about it. You know, I'm not sad about it. But anyway, so that was pretty much it. After that, they put me into a recliner and took the IV out and gave me some more Jell-O. And then we left, and my parents went to go get my prescription, and then we went to Walmart so that my dad could get a few things. I didn't have to go in with him, but I have to say, I'm able to walk just fine. It's 24 hours now, I think about 24 hours, and I still have not had any vertigo or other side effects, just pain. He did tell me yesterday that he was going to give me a large injection of steroids in the IV. And he does that to help combat vertigo. And, you know, that clearly worked. But I think it was also a clean implantation, because I can't, you know, I can still taste, I can still, you know, there's a little branch of the facial nerve that feeds taste to the right side of your tongue, and I didn't have any damage to it. And obviously I'm still talking fine. And then I pretty much came back here and rested. I woke up, I had dinner, and then I rested some more. What I was amazed at is how alert I was when I was awake. I remember when I had the surgery when I was 14, I can remember sitting in the car being exhausted, trying to talk to my grandfather on the phone and kind of slurring a little bit, you know. But this time I was actually I was wide awake, and I was alert and stuff like that. I like this better, you know. But anyway, so that's pretty much what happened yesterday. Now we just have the waiting game. My parents will be here until next Friday, kind of helping me recover. So I'm very thankful for that. They came down from Texas. And, you know, I have to say, if there's one thing that I learned out of this, is that, you know, being able to have parents that are willing to drop everything and do something like that is a real blessing. And I've certainly learned to be more appreciative through this whole experience. But anyway, it's the waiting game now. I'm going to get the implant activated in about a month. And my audiologist has given me permission to video the experience, but I still don't know if I will or not. I'm still trying to decide if I want to or not. But that's pretty much it for this video. Thank you for watching, and thank you again for all of the thoughts and prayers yesterday. They were definitely appreciated, and they were definitely felt. And so I will wrap this up here. If you like this video, feel free to subscribe. I promise you, not everything on this channel is going to be talking about cochlear implant surgery. So it's called Blind Coaster Fanatic because when I go back to amusement parks next year, I intend to do some vlogging from those parks and maybe do some on-ride POVs with the GoPro that I got this week, which I haven't really been able to play with, obviously, because of this surgery. And I can't ride roller coasters for the rest of the year. My surgeon asked me not to. Because the bone has to grow around the implant to kind of hold it in place. That's why. So he said, go easy with that for 3 months. So, I will. But anyway, thank you for watching, and take care.